If you are less than 40 years old and have frequent back pain, you may want to stick around because this might not just be your usual back pain. In today's video, I'll tell you all you need to know about ankylosing spondylitis, a very common cause of back pain in young adults, especially men. Welcome to another episode of Doctor Says. Ankylosing spondylitis is a disease that causes pain and stiffness in the back, neck, and sometimes hips and heels. It begins with inflammation around the bones in the spine and joints. As the disease progresses, it can sometimes cause the bones in the spine to fuse together, limiting mobility and functions. What are the symptoms of ankylosing spondylitis? The most common symptom is a pain in the lower back. This pain usually starts in early adulthood, usually before the age of 40. It comes on slowly and lasts for more than 3 months or longer. The typical feature of this pain is that it becomes worse after resting, such as first thing in the morning. Patients often feel stiffness in the back upon waking up, and as the day progresses, the pain becomes better with exercise and movement. The back might also become less flexible. This can make a simple daily task like putting on shoes difficult and may lead to a hunchback posture over time. Because ankylosing spondylitis involves inflammation, other parts of your body can be affected as well. People with ankylosing spondylitis may also experience inflammation of the bowels, causing abdominal pain and diarrhea, inflammation of the eye, causing eye pain and redness, heart valve inflammation, and inflammation of the tendon, in particular Achilles tendon, causing pain in the heels. Who is at risk of developing ankylosing spondylitis? It is believed to be genetically inherited, so your chances of getting it is higher if you have any close relatives who are affected, especially if you have a gene called HLA-B27. Second, if you are between the age of 20 to 40, as this disease tends to occur in late adolescence to early adulthood. Lastly, if you are a man, you are twice as likely to develop this disease as compared to a woman. As for the diagnosis of ankylosing spondylitis, it's a combination of physical examination, blood tests, as well as radio imaging. Examination of the joints of the neck and spine will reveal a lack of joint mobility. X-rays of the hips may reveal bony erosion, narrowing of joint space, and the typical feature is known as sacroiliitis, which means inflammation of the joint between the bone sacrum and ilium. Another typical appearance of the spine X-ray is known as bamboo spine, and this is caused by the fusion of the adjacent spine as a result of chronic inflammation, giving the appearance of a bamboo. Please smash the like button if you see any resemblance. In the early stages of the disease, where an X-ray might appear to be normal, an MRI spine is more sensitive for detection. Genetic testing like HLA-B27 is present in 85 to 95% of Caucasians with ankylosing spondylitis. Hence, it can be used as a screening tool for patients with chronic back pain. However, a negative test does not necessarily exclude this disease. As this disease is a disease of inflammation, blood inflammatory markers like CRP and ESR will tend to be high. Moving on to the treatment, the general rule of thumb is to avoid and stop smoking, and the next important thing to do is to exercise. Exercise is key in treating ankylosing spondylitis, and this includes postural training, range of motion exercise, muscle stretching, and strengthening exercise. For the best results, it is advised to see a physiotherapist for proper evaluation. The initial drug therapy is aimed to relieve pain and inflammation, and non-steroidal anti-inflammatory drugs or NSAIDs is proven to be effective. Examples of NSAIDs would be naproxen, ibuprofen, or Celebrex. Approximately 80% of patients will experience relief of symptoms, and for the majority of them, NSAIDs is the only medication that is required. Unfortunately, for some of those who have a more severe and active disease that does not respond well to NSAIDs, a more hi-fi drug known as biologics is recommended. Examples of biologics would be TNF inhibitors and interleukin-17 inhibitors. These drugs are typically very expensive and will only be prescribed by a rheumatologist that is specialized in treating ankylosing spondylitis. So there you have it, guys. The next time you have back pain, you may want to think again. Is this just a normal back pain? But do you know what is worse than a back pain? A buttock pain or tailbone pain. Want to know more about it? Click on the screen to find out now.